Hi, this is Dr. Masuda. I am a podiatrist in the Chicagoland area, and I'm here today to talk to you about diabetic foot care. If you're a diabetic, juvenile or elderly, type 2 diabetic, you need to take care of your feet. Foot care, you have to examine your feet every day, top, bottom, and make sure that there's no cuts, no openings, which we call an ulceration, no bleeding. Check your heels, make sure that they're not dry and cut up, and check your shoes, make sure that there's nothing that is irritating your feet, that the shoe is new and the shoe is comfortable. As a diabetic, you need to check your feet every day. Use a mirror if you cannot reach it, and when you take a shower, dry your toes really good and between your toes, because as a diabetic, it's easy to get a fungal infection. Also, as a diabetic, it is important to see your podiatrist on a routine basis. Medicare allows a visit every 61 days. Make sure you see your podiatrist to cut your nails, to treat any cuts, any blisters, any opening, any ulceration, and Medicare pays for one diabetic shoe a year. If you do develop ulceration, which is an opening of the skin, make sure you see your podiatrist right away so it can be treated on a regular basis until it heals and it does not go to the bone or it gets infected. The best way to take care of your feet is to control your diabetes, take care of your diet, control your sugar, and exercise daily. Walk on a routine basis, half an hour every day. That increases the circulation to your feet. It increases the blood flow to the extremities and decreases the chances of forming ulcerations and complication of poor circulation. To finalize, I will give you some foot care tips. Manage your diabetes. Check your feet daily. If in case you need to use a mirror, use a mirror. Avoid walking barefoot. Always walk with a closed-in shoe. And don't use any medicated pads or medicated solution on your corns. Don't try to trim your corns yourself because you can bleed and you can get infected. So don't use anything that's medicated because it has salicylic acid and it will give you a burn, a blister, or an ulcer. Do not smoke. Smoking cuts circulation to your feet. Don't use any tight socks on your feet that will cut your circulation. There's diabetic socks, comfortable cotton sock. Don't use anything with a lining or with a trimming that will irritate you. And the final step is don't use any heating pads, because if you have any neuropathy, which is numbness, which is common for diabetics, you won't feel the heat. So don't use any heating pad. This is Dr. Masuda. If you need any more help with your diabetes, please don't hesitate to call us. Our number is 773-752-2111, or go to visit our website at www.footexpert.com. Thank you.